Good morning. My name is Dr. Paul Scheiwiller. I'm an anesthesiologist here at the Institute of Orthopedic Surgery. I'd like to speak with you today about your nerve blocks for postoperative pain management and what your anesthesia plan would be like for your upcoming total knee replacement. The role of the anesthesiologist is simply that I am personally responsible for all your anesthesia care. I will visit you each on the day of surgery, and I will be performing the nerve blocks. Moving forward, just for clarification, when I say me, it also is referring to my colleague, Dr. Zeligowski. Him and I both perform all the procedures that I'll be outlining. Also, your anesthesia will be most likely performed by a nurse anesthetist, which is a specially trained nurse provider that will provide you your anesthesia care. We work together as a team, and you'll be meeting all of us on the day of your surgery. People ask, why do we even do nerve blocks? Generally, we do nerve blocks so that you'll wake up with less pain and you'll be more comfortable than if you didn't have a block. Generally speaking, you'll require less pain medicines. Pain medicines can be associated with undesirable side effects, which include nausea, vomiting, urinary retention, sleepiness, sedation, confusion, breathing issues, and many times constipation. Also, I like the term less is more. And by this, I just simply mean that during your operation, if half of your leg is very numb, your requirement for anesthesia is generally much less. This reduces side effects, especially for our older patient population. Now, I can see in the room that nobody appears to be very old, but if we had older folks, this would be something that would be very beneficial to them. You generally wake up quicker, you have less chance of an anesthesia hangover, you generally have less chance of nausea, vomiting, and if you're not hungover and nauseous and vomiting, you can generally start eating and drinking. That's when most of our patients start to feel their best. Will you get a nerve block? Generally speaking, most every patient is offered a nerve block here at the Institute of Orthopedic Surgery. The surgeons request a nerve block based on the procedure and patient-specific information, and I will perform the nerve block as long as there are no contraindications to doing so. I will mention that patients that are getting bilateral total knee replacements are offered nerve blocks on a case-to-case basis. I'd like to describe for you here in the next 10 minutes or so what you can expect from your anesthesia on your day of surgery. Of course, I refer to this as your big day. You will enter the building and you will go into our clerical area, our reception area, where you'll be taken care of by our staff. You'll be asked for your insurance information. They'll take your picture. Then you'll go through our doors and you will go into the preoperative area. And that's exactly that. That's the area where we'll be getting you ready for your operation. This is where I will meet you or someone else from the anesthesia team. We will look over your chart. We'll go over and do an examination on you, listen to your heart and lungs, and then we'll talk to you about your anesthesia plan. Also, we will be performing your block in the preoperative area. I want to give you a little information about the types of nerve blocks that are done. Generally, all nerve blocks are divided into two very large categories. One would be a single shot nerve block. The other is a continuous nerve block. A single shot nerve block is the same type of procedure that a dentist would do in his office. Quite simply, he places a needle into the gum between the cheek and gum next to a nerve, injects a small amount of medication, and that nerve falls asleep. The dentist's goal is generally to get you numb quickly and isn't particularly concerned about how long the block lasts. However, here we are particularly concerned about the length of duration, and our medications that we use are quite different. Our blocks here at the Institute of Orthopedic Surgery generally last 12 to 24 hours. So if you get a single shot nerve block, 12 to 24 hours would be the expected duration. The second type of nerve block is a continuous nerve block. A continuous nerve block is a highly specialized nerve block that's generally done only by anesthesiologists. In this procedure, a small hollow tube is placed through a needle that is placed next to your nerve, similar to a single shot, and we pass the nerve we pass the small tube through the needle, lay it next to the nerve, and hook it up to a pump that runs in for approximately 2 days. The nerve block that we do is called a femoral nerve block. Femoral nerve covers about 2/3 to 3/4 of the front of your knee. We call this the major block because, again, it is the majority of the knee. So how do we do this? It's a very simple procedure. Generally, we place you on your back and we prep the area. Then we do the best thing and we give you a little bit of sedation, roughly equal to 2 Bud Lights. Then we take a fancy ultrasound machine, which is one of the best things that's ever happened to our profession, and I place this ultrasound machine right over your nerve. This allows me actually to see the nerve underneath your skin. I take a tiny needle and I make a little numb spot, which is about the size of a dime, and I use a tiny needle about the size of what a diabetic would give themselves an injection with. I then pass a needle through this numb skin, again watching it very carefully on my ultrasound machine, and I approach the nerve. Some of you, we will be using a needle that twitches, which will make your thigh skip. This is not uncomfortable, it's just a very odd feeling. I place that needle right up next to that nerve, and then I do one of two things. If your surgeon has ordered a single shot injection, I will simply inject the medication and remove the needle. Again, if it's a continuous block, I will slide a tiny tube, again a small catheter, it's about the size of a fishing line, it's hollow with the holes in it, and I lay that right next to the nerve. I remove the needle, I secure this to your skin, we put a dressing on it, and I hook you up to a pump. And this will run in for approximately 2 days. Once the block is completed, we'll generally take you back to the operating room. We'll do one of two things. We'll either give you a general anesthetic or a spinal anesthetic. We decide this on a case-by-case basis. We use patient preferences, many times surgeon preferences, but we do generally always what's best and safest for you. If you have sleep apnea, you will definitely be a candidate for a spinal anesthetic. These blocks can take a long time to start working, up to 45 minutes. There is a large variation to the onset, and I will tell you that these blocks will not make your leg numb. They don't make your foot numb, but they will make your leg feel very heavy. It's a very odd feeling. I've had a block like this myself. Once your procedure is done, you'll be waking up. Many of you will notice that you have some discomfort. Many of you will notice this on the sides of your knees and on the back of your knees. The pain is less than it would have been, and we will give you additional pain medicines as needed. I would like to just mention that the total knee replacement is an extremely painful operation. I'm not trying to startle anybody, but it is a very significantly painful operation. We will do everything that we can to try to help you and make this as comfortable and safe for you as we can. And speaking of safety, it's very important that you understand that you are all at a high risk for falling. And it is absolutely imperative that every time that you feel that you need to get up, if you just simply want to look out the window, it's important that you call your nursing staff and that you wait for them to come and assist you. Again, you are at a high risk for falling. The gentlemen in the room frequently are the ones that don't call the nurses, and this is simply, I think, because the gentlemen don't want to bother the nurses. It's very important. They expect you to call them. Please make sure you call them. And ladies and gentlemen, both pay particular attention in the bathroom, as this is a slippery and confined area and many times is an area where falls can occur. So just be very careful. Make sure that you call your nursing staff. Our fall rate is very low here at the Institute of Orthopedic Surgery, and one of the reasons is we start talking to you about this very early on. We've just spoken about your safety. I want to cover your comfort. It's very important that you understand that in the overnight care unit, that when the nursing staff comes around and offers you pain medicine, that you should always accept the pain medicine. Your pain medicine will be changed and gauged on how much pain you're having. We do not recommend that you skip any pain medications, as you want to keep up with your pain medicine so that you do not fall behind. I always say it's easier to stay comfortable than it is to get comfortable. So please keep up with your pain medicines. Very important. I'm going to ask the nurse moderator to discuss with you washing of the inguinal fold area. This is just to remind her, the slide. I will be in very shortly to answer any questions that you might have regarding the anesthesia or your blocks. But before I do that, I just want to remind you all that if you are sick the day or two before your surgery, we would like you to call us. Many times we will send you to your family doctor for evaluation, or sometimes we even bring you in and eye check you out to make sure that you're well enough to have your operation. I like to flash this slide at the end. This was done by a 3rd or 4th grader in a contest, and this is just simply to warn you and show you that it's very important that you're very careful with your walking and to decrease your fall risk as much as possible. Again, thank you very much, and I look forward to meeting you hopefully very shortly.